Today we're going to talk about normal delivery and normal placental delivery. When you say normal labor, it means there are spontaneous onset, rhythmic and regular uterine contractions, vertex presentation, and no maternal or fetal complications. We are going to tackle about the second stage of labor. So this begins when the cervix is fully dilated at 10 centimeters and is completed when the baby is completely born. After the cervix is fully dilated, the mother typically has the urge to push. Observe a sepsis procedure. So for the delivery, as one hand supports the perineum, the other hand is used to guide and control the fetal head to avoid expulsive delivery. A finger should be passed across the fetal neck to determine whether it is encircled by one or more umbilical cord loops. The fetal head then falls posteriorly, bringing the face almost into contact with the maternal anus. The occiput promptly turns toward one of the maternal thighs. The sides of the head are grasped with two hands, and gentle downward traction is applied until the anterior shoulder appears under the pubic arc. Your assist maintains his or her hand supporting the perineum until the baby is delivered. Then, by an upward movement, the posterior shoulder is delivered. The rest of the body almost always follows the shoulders without difficulty. Your left hand will be holding the neck and your right hand will hold the feet of the baby. Afterwards, place the baby prone on the mother's abdomen. The umbilical cord is cut between two clamps, placed 6 to 8 centimeters from the fetal abdomen, and later an umbilical cord clamp is applied 2 to 3 centimeters from its insertion into the fetal abdomen. For the delivery of the placenta, immediately after newborn birth, uterine fundal size and consistency are examined. If the uterus remains firm and there is no unusual bleeding, watchful waiting until the placenta separates is the usual practice. Massage is not employed, but the fundus is frequently palpated to ensure that it does not become atonic. Apply pressure on the lower part of the uterus with one hand while giving tension to the umbilical cord. Cord traction must not be used to pull the placenta to prevent uterine inversion. Observe for signs of placental separation. After ensuring that the uterus is contracted firmly, pressure is exerted by a hand wrapped around the fundus to propel the detached placenta into the vagina. The umbilical cord is kept slightly taut, but it is not pulled. Concurrently, the heel of the hand exerts downward pressure between the symphysis pubis and the uterine fundus. Once the placenta passes through the introitus, pressure on the uterus is relieved. The placenta is then gently lifted away. Care is taken to prevent placental membranes from being torn off and left behind. If the membranes begin to tear, they are grasped with a clamp and removed by gentle teasing.